Well, friends, welcome to today's session. And today we have a very famous medical educationist, Dr. Sucheta Dandekar. And I request Dr. Nirmala Rege to present her biodata.
Thank you,
Over to
Dr.
you, ma'am.
Yeah, thank you, Dr. Sanjay. Am I audible?
Yes, you are audible, ma'am.
Okay. Today evening, Dr. Sanjay called me and he requested me whether I can present Dr. Sucheta Dandekar's biodata because she is my friend. And but if I ask participants over here, I think she must be a close friend of everyone over here. We call her as Jagan Mitra, as they call it in Sanskrit. And when you utter her name, there stands a person before you with pretty face, infectious smile, twinkle in eyes, and full of enthusiasm, wearing lovely saris and her signature jewelry. But she is a very rare combination of beauty with and brain, and she has a number of laurels to her credit in academics. She was professor and head of the Department of Biochemistry of St. J.S. Medical College and KM Hospital in Mumbai, from where she superannuated, and now she is a professor of biochemistry at IRA's Lucknow Medical College. And she's also adjunct faculty at Manipal Academy of Health Education. She has, may I request the participants to keep on mute? Uh, she is a FEMER Philadelphia 2010 fellow, and she was awarded the International Fellowship in Medical Education, IFME. And later on, she has never rested on her laurels. So she processed further to do masters in health professions education from Kils University. She was a founder, actually is a founder member of GSMC FEMER Regional Institute, and is involved with the PhD FEMER as well as MAHE Philippi Regional Institutes. And currently she is also a global faculty and project advisor at the International FEMER Institute, Philadelphia. She is currently member of Quality Assurance Committee and global consultant at FEMER. Apart from this, she is a very prolific writer. There are a number of, she has done a lot of research work in biochemistry. And there are a number of books and publication in national and international journals to her credit. She's a recipient of say JS Medical College and KM Hospital Oration, as well as Avadesh Saran Oration Award. She has received University of Mumbai Oration in biochemistry. And she was a past president of Association of Clinical Biochemists in India. And also she has been an assessor in NABL and presented her research work apart from publication in various conferences here as well as at international level. The most important thing is that she is a teacher par excellence, and she has won Best Teacher Award from our Maharashtra University of Health Sciences. And but she exists also beyond this academics. So she's a great organizer, may that be a conference or any event or any cultural program, shopping, organizing tour, or even hunting for the best eateries in any town. You can't just ignore her in all these activities. And I consider myself blessed person to have her as my friend. And I think I'm the most benefited person because I've worked in close association with her for so many years. And I'm very proud that she is presenting today's Rita Sud oration that is beyond horizon, changes that will shape the health professionals of tomorrow. So Sucheta, stage is
Thank you.
yours.
Thank you. Thank you, Nima, for that very kind introduction. I would like to share my screen. Can my slides be seen?
Yes, ma'am.
Right. Thank you, MEU India. Thank you, Dr. Sanjay Bedi, Dr. TS, and the MEU committee for bestowing on me this honor. But before I begin, I would like to very fondly remember Dr. Rita Sood. I had the privilege of knowing Dr. Sood for many years, both as a person and as a professional. Very simple, very humble. A dedicated professional, she set a high standard for all those who worked with her. And medical education was truly close to her heart, and she devoted much of her career to improving it. One of Rita's most significant contributions was the development of the KL Wig Center at the AIIMS, Delhi. When I visited AIIMS for some biochemistry exams and she learned that I was there, she invited me over to the center. It was one of the first centers, dedicated medical education units that I saw. It was one of, and Dr. Sood, along with Dr. Adkoli, had published an educational booklet that became an invaluable resource for many of us. We used it with great enthusiasm, benefiting from the wealth of knowledge it contained. I truly appreciated her simple tastes and frugal lifestyle. We have had many a breakfast together at the conferences, and her modest breakfast inspired me to always take a little less on my plate. On a personal note, one of Rita's sons used to reside in Mumbai, and she would make it a point to call me at least, when she was there in Mumbai, when she was in our city. A true role model, Dr. Sood will always be remembered very fondly. A big thank you, MEU India, for this. So when I was given this award, I was wondering what is it that Rita would have, thought of, and I thought that it would be good for us to think of or to present what are we going to do as far as the health professionals are concerned, and that is why the choice of this topic, Beyond the Horizon, changes that will shape the health professions of tomorrow. So this is the trajectory of events so far. The oft quoted Flexner in 1910, he brought about standardization of medical education. He is the one that the Flexner report, the famous Flexner report in 1910, actually brought about partnerships between medical schools and teaching hospitals. That is what was suggested. And that is how we always have this liaison between hospitals and medical schools. The report also suggested integration of basic sciences and clinical training. And it sort of set the stage for the modern medical education system. And but the impact was seen far and wide, because all over US, we found that about 50% of the medical schools had to be closed down because they did not fit into the scheme of things and into the guidelines that were being laid down. And a decade later, all this was happening, but it took 100 years for Frank et al. To actually come out with again, we have seen this often, the Lancet Commission on Health Professions for the 21st Century. And that report brought about the expectancy of the competency-based curriculum. It suggested for a system-based approach. It talked about global health perspectives and interprofessional education. So there were many reforms that were suggested, and we saw that we saw that that the goal was transformative and interdependent professional education for equity for health. And it was written as far as the components were concerned as the structure and the instructional design, and the proposed outcomes were in interdependence in education and transformative learning. So this is what the report told us. And in India and all over the world, CBME was born. In fact, we are now, already about 2 years into CBME, and we are looking as to what are we doing as far as this entire education system is concerned. CBME can help all training programs do better for the patients and populations they serve, definitely. It will deliver the delivery of patient-centered care should ideally be done by an interprofessional team that makes accurate diagnosis, maximizes meaningful engagement in life and death decisions, and coordinates care. CBME can also bring back many things that we should embrace, most notably bedside rounds, direct observation, and faculty judgment. You may say that we've been doing all this, but we should do it now in a more rigorous and systematic manner. This led, Eric Hombo was one of the authors of this paper, which talked about new job roles for educators. So what are we because of all these changes that are occurring, what are the new job roles are us educators that we will need to take on? The first one they suggest is diagnostic assessors, where we will use the results of big data to identify individual group performance gaps to individual training. We also need to have content curators who will access, select, sequence, and deliver high quality content, which will be developed by national experts. We need to have technology adopters so that we are fluent in selecting and using appropriate technology tools. The educators will need to be learner-centered navigators and professional coaches, where the resources will be there, but the use of these resources to achieve identified targets will have to be channelized. We need to have clinician role models. I mean, the more that is said, the less it is. And the last but not the least, we need to be learning environment designers. We need to sync with the engineers, with the architects, with the implementers, so that we are able to design space to optimize learning informed by sciences. So you can imagine there's so many things that we have to now learn and unlearn as far as learning, as far as the entire gamut of teaching learning process is concerned. This paper which came out in 2023 has now set out new roles in the era of CBME, and there are 10 new roles that are defined, 7 of which are faculty specific and 3 of which are administrative staff roles. So we realize, and we've seen this also as we are implementing the CBME curriculum, that we cannot just be the educators and the teachers in silos. We need a lot of help from administrative staff also, because information technology, etc., is coming a long way, and we need assistance to put this forward. So having said that, and when all this was happening and the CBME was just put into action, COVID-19 struck, and when that struck, even before that, an examination of what was happening with CBME was already underway. Frank et al., along with Shen from the University of Miami, were already looking into how is this working? Is this really working or not? And that is when Frank et al. In 2022 came up with so many aspects about adaptation to technology advance, emphasis on public health and epidemiology, focus on health equity and social determinants, eminence. And that is when, because COVID had already struck, they came up with the idea and with the understanding that we need all our the health professionals to be resilient and to be prepared for crisis situations. And they came up with this paper in 2023, and which talks about the dynamic factors that stimulate change. And they talked about new educational technologies and the transformation of health systems, all of which will cause will lead to an education for life. This education for life will be three-pronged. We will need to, of course, be learners throughout our life. And that is also one of our goals as far as our Indian medical graduate is concerned. But we also need learning to promote and restore healthy lives. We need to have people who are aware of such things, and individuals learning to live their own lives. Now, this is very, very profound. We need to have people who will understand that they not only need to care for the system, but they need to take care of themselves. Burnout and so many aspects of mental ill health have been the core of what all we have been talking about. And that is what we need to hone into our students and into our friends, that not just live your life as a professional, but see that you learn to take care of yourself too. And that is why they have now said that we need to have a framework of health professions competencies. We need to have competencies at different levels. One of them is the foundational competency, thorough knowledge of theories, concepts, and facts accepted by the scientific community that forms the basis of our professional practice. Along with that, we need to have specialized competencies. This we will all agree, depending on our profession or specializations. With that, we need to have integrative competencies, which will also hone the complex capabilities of critical thinking, creativity, emotional intelligence, etc. And last but not the least, teamwork. This is what we need to look into. And that is the reason why our CBME or whatever curriculum that we make has to be a slightly flexible and slightly adaptive too. So using education for life as a principle for health professional education, expanding competency-based education into newly recognized areas, using learning technology to make health professional education more effective, efficient, and inclusive are the need of the hour. And with that, we need to think of what is going to happen next. And that brings me to the 2024 discussions that happened at the international conference in Miami on the future of health professions education. This is what they said. We need to develop a fit for purpose health workforce. We need to see remedying the lack of coordination and collaboration across health professions can begin by working across silos in the universities. Health professionals will have to improve their communication skills. We know that we need to help, they have to be comfortable talking to their patients, talking to their relatives, etc. But in broader discussions, we should also train them to face the public, to see that they are able to tell the community about any precise or changing information that could be there. And the universities should look for opportunities to develop these skills. Introducing new competencies means leaving space in the curriculum to include unexpected learning opportunities. That is the reason why I shudder every day when that timetable for the month is unveiled to us. And when people tell me that this is what is sent to the NMC, and this is the way we are going to work at it, and there is going to be no change. I mean, if I want to do something a little hatke, if I want to think out of the box and I want my students to be with me to do something a little away, I have to put it into that grid and see that it happens. So somewhere we need to rethink this grid business and this fact that, that you just have to do this and no further. Because we need to have a willingness to tear down the orthodoxy with respect to practice, accreditation, and licensing. And always remember this, that students want to be on the front lines and can help to fill gaps in the delivery of healthcare services. And we saw this so well during COVID. I think if we didn't have our residents being there, standing there with their PPE kits on, I don't think we would have ever achieved what we did during the pandemic. And hats off to the students who helped us achieve what we did. And that is the reason why we are here thinking of how best we can help them as time goes on. And that is what Julio Frank has said, that this is the moment to pursue a quantum leap in health professions, education, innovation. And all of us are here to see to it that it happens. Responding to the needs of this has come to the surface because it is an opportunity for building a better normal. There are so many aspects that are talked about. First of all, we have the global and health challenges. We need to now remember, we need to address the pandemics, tackling health inequities and social determinants. Technology integration is the need of the hour, advancing simulation and virtual reality, incorporating artificial intelligence and big data in curriculum, enhancing team-based learning and practice, and breaking down silos between health professionals. Along with that, as I said earlier, we need to have a flexible competency-based program, emphasizing lifelong learning. And along with that, focusing on student and practitioner well-being and building resilience in the healthcare workforce. The global perspectives cannot be forgotten, and that is why promoting international collaborations in education and addressing global healthcare workforce disparities will go a long way. In this whole scenario, we have this DEI, which will involve in the health professions education. And if we do not have all these aspects honed in and added in, then we are going to be nowhere as far as the whole curriculum is concerned. And that is why we need to embed it in our curriculum. So developing the competencies will be an essential step in providing cultural responsive care and achieving optimal patient-centered outcomes. So we need to envision the future. And when we envision the future, capitalization on the power of technology and data comes to mind. E-health, electronic health records, assisted living, mobile health, e-prescriptions, data-driven automation prediction, artificial intelligence and machine learning, telehealth, all come to our mind when we talk of this. Along with that, we have the language learning models that will go a long way, which will involve a blending of technology and personal engagements and adaptive learning platforms, which will be powered by LLMs. LLMs, when linked to pedagogical imperatives, can make health professions education more effective, efficient, and inclusive. They can improve educational responsiveness to the benefit of both the students and the teachers. They enable field and clinical experiences to be stimulated and with immediate feedback given to the students. Beyond the campus, technology can facilitate building community of practice and deliver gains in productivity. However, there will be challenges and considerations to be taken into account. And the first that comes to mind is the accuracy and reliability. Ensuring that the information provided by the LLMs is accurate and reliable, as medical education requires high standards of precision. We also need to handle sensitive medical data with care, ensuring patient privacy and ethical use of information. And of course, all this has to be supervised. LLMs should complement and not replace human educators and practitioners. It should ensure that the human oversight is always present. So, by integrating LLMs in education, in health professions education, we can enhance the learning experience, making it more interactive, personalized, and accessible, while also preparing students for real-world clinical practice. Leading us to think of the innovation in education and assessment. We have here a small bit from Bates' book on digital in the new age, and he talks about what is it that the teachers need to do, and this is my bit on what our students will need as far as the whole environment is concerned. You know, they go right from the learner characteristics to skills, to settings, to assessment, to technology. Look at this whole gamut of things that we need to think of. And last but not the least is the motivation that we have to inculcate and hone into our students so that they want to learn and they want to change for the better. And with all this talk about change, let me tell you that the classroom is going to change. The layout of the classroom will change immensely. We will have standing, I hope that even in India, we will be able to do this. We can have standing desks for students who have difficulty in maintaining focus while sitting. Accommodation for students who need more movement. Private workstations, interactive projectors, and other technologies. Students will be given more autonomy, and moving walls to make more space will happen. And I mean, I have seen it happen in some cases, some institutes as well. So it is slowly coming into being. Virtual and augmented and mixed reality will change the educational landscape. And it means that various learning styles, etc., also will change. And then we need to think, can we have flexible assignments which can accommodate the multiple learning styles? This is a food for thought. Along with that, there are the massive open online courses, the MOOCs, that will be an option, and it will cause a very great impact on secondary education. Coursera offers so many courses that can be used. And in fact, I underwent this Coursera course from the IIM Ahmedabad, where Vishal Gupta conducted it. And then we learned about the leadership skills, honing of leadership skills. And there he talked about building a work culture through LEAP. And what is LEAP? LEAP is learning, enjoyment, autonomy, and performance. So we have to inculcate the fact that people should enjoy being in their workplaces. And there have to be ways in which we can help our people in the environment to build this and to enjoy being where they are. So connecting young people to a meaningful course of study and practice will build their confidence in institutions, in each other, and in the future. It will strengthen their belief that what lies ahead is better and that they have an important role to play in defining and creating a better future. And remember that everything is going to change. And this Forbes site, which talked about 10 biggest trends revolutionizing healthcare, I couldn't help but, thought I should introduce this to you all. They talk about preventive healthcare. They also talk about IoT powered virtual hospitals and telemedicine too. What do I mean by IoT? This trend which includes both telemedicine and wearable devices connected to the global network devices known as the Internet of Things. By connecting the devices to remote patients, we can monitor them and provide communication channels to them. And we call this telemedicine too, because it goes beyond the simple delivery of remote care, such as remote consultations, to a more holistic approach to patient care and treatment. And then there is the third aspect of virtual healthcare assistance. Virtual assistants and chatbots can help to provide advice on treatments, diagnosis, and medications. They can also help patients to answer questions about their care and connecting them with the information that they may need. So they can even provide companionship for patients. In remote areas. The fourth trend will be the digital twins. Digital twins of the human body and individual organs have been developed, to understand the effects of changes in treatment, medication, and lifestyle choices. And the most currently imaginable twin that is going to be soon launched, so to say, is the twin of the human brain, which researchers are working on. So I eagerly wait to see what happens with this. And then there is the personalized medicine, creation of tailored treatment plans for individual patients. And then the virtual and augmented reality that I talked about, which will help to enable precise surgical planning and real-time visualization of complicated medical data. But with all this technology, we cannot forget elderly care. Remember that the elderly care population is increasing by leaps and bounds. All people like me are also an example, growing old and yet being there. But with this, we need to converge mental and physical healthcare delivery. Both these will go hand in hand, and that is what has to be looked into with fervor. In regions where medical equipment is hard to come by, 3D printing will go a long way. And we will be able to print tools and devices on demand, including dental implants, orthopedic implants, prosthetics, etc., and instruments. So this is also a very encouraging trend that will change. And along with that, of course, you have the generative AI in healthcare, which will lead to easier to implement and interpret results and generate personalized implications to the whole story. So you can see so much is going to change that we need to also hone our health professionals' skills. And gone will be the days when our students will want to just do a PG in a particular discipline. We will have technocrats, we will have health professionals who are technologically advanced also. And I'm telling you, this will be their day and time. With all this that I've talked about, there will be challenges. Let us not forget the cost. Implementing new technologies can be expensive, especially for small healthcare organizations. There can be resistance to change and lack of interoperability, because interoperability between different healthcare systems and technologies can be a significant challenge, hindering the sharing of patient data. I'm telling you, even a small thing like liaisoning our labs to the main patient data took us so long to actually implement, and we've been struggling throughout, and that is the reason why we have to remember that whatever we want to introduce with great fervor, there will always be some drawbacks, and we need to prepare our students for that. Reimagine the composition of the healthcare for workforce. Health systems rely strongly upon data systems, and a skilled workforce is needed to connect the systems to innovative modes of instruction and delivery of care. Building talented cadres of professionals with these areas of expertise will be essential in developing and sustaining responsive, effective healthcare systems. Let us not forget this. And along with this, we need to learn across countries. Working in low resource settings also can drive innovation. Engage students in clinical care at an early stage in their education. Empower community workers as health agents. And that is the reason why time and again, everyone is talking about cooperation. People are saying, let everyone be, all of us can make this world a better place. And that is why we need to re-examine the role of the university. Universities shall need to design an open architecture to meet the changing needs of professionals throughout their careers. They need to become responsive to diverse needs of learners, shift to a system of education for life, learning to promote and restore healthy lives, health professions learning to build and sustain their own healthy lives. And that is the reason why fundamental questions about what to teach, how to teach, when to teach, and whom to teach will play a big role. To empower students to transform healthcare and to inspire them to serve begins with emphasizing clinical skills, professionalism, communication skills, and the social determinants of health early in their training. And last but not the least, creating opportunities for community of practice. We will have to focus on health creation and primary care, and the spotlight will shift from disease treatment to health prevention and creation, addressing the social determinants of health and transforming healthcare professionals into agents of transformative change. We need to also change the admission process. What happened just this month has been very, very, very heartbreaking, so to say. And Niloy Sinha in his MEU Google group has brought it out so well. He talks about, how people have made sitting ducks of us. And can we use this giant duck to change? And will this giant duck survive? Or will the academic environment depend only on the IQ of the patient or of the student? And will it also, we will also depend on the integrity of the assessment system. He talks about how we have been, fattening the ducks, so to say, fattening the Peking ducks, he says, and we have been fattening them with this academic feeding. And what happened as far as that result was concerned, we had too many toppers. And with so many toppers, we have lost the exclusivity of being the one in a million. And there is, this academic feeding that he talks about. When we bloat the students with too much to do, there will be a premature burnout and an exhaustion. And we will always be looking at what is happening as far as their careers are concerned. And whom are we going to blame? Are we going to blame the system? Are we going to blame the object-related mapping machine? Are we going to say that, we want all our students to be equal, and that is the reason why we fed this whole system with the equality bug? All this, let me tell you, is food for thought for all of us. And I am just at a loss for words as to what can we do to prevent this from happening. You know, we have such a sad state of affairs as far as this happening has happened in this country. I just need to take a small breath there, because it makes me so emotional as far as what has happened is concerned. But we need to think that the roles of the students are also changing. Harden and Harden, in their very recent ebook, which is published in 2023, talk about them being information processors, curriculum collaborators, facilitators of learners. They are, of course, professionals, scholars, assessors, and teachers. And this is what we have to bear in mind, because we are going to change their roles, and they are going to change for us. And there are these 10 key features of the medical school of the future that they have put forward. They talk about the real world and authentic curriculum. They talk about just-in-time learning, basic sciences and clinical medicine integration, importance of teaching and teachers recognized. And that is why we have to be and understand about our changing roles too. And students at Partners, Nima and I took a whole webinar on students at Partners for the AHP very recently. There has to be a map journey. We cannot just say that this curriculum is a mystery tour. And I'm glad that the CBME, in a way, whatever the NMC has done, they have channelized all our thoughts, and we do have our objectives in place now. But we need to have an adaptive curriculum with adaptive learning, creative use of technology, and program-focused assessment for learning, along with greater collaboration. For all this, we need to change the community. And the topic of social accountability, which is very close to my heart and was also part of my MHP thesis dissertation, I cannot stop without explaining or talking about it, because the students should move, and the community should move from being responsible to being responsive and to being accountable. And the health system should have the change agents, and we need to have everyone as health partners. Social accountability shall prepare the health professionals to meet the needs of the diverse populations, tackle health inequities, and work towards better health outcomes for all. So producing socially accountable graduates and having the right healthcare deliveries institutions where social accountable graduates practice social accountable medicine will be the need of the hour. And this is from a chapter that TS and I have written together, which will be published soon. But this is our take on what is it as far as social accountability is concerned. These are the stakeholders in the partnership. And this is all that we do as far as the CBME is concerned in India. And looking at the values of social accountability, of relevance, equity, quality, and partnership and effectiveness, we have to inculcate all this that we do into these values. And that is when we will have a socially accountable community, which will be also added on to the clinical teaching and the teaching learning process by having or providing a positive learning environment. So there is a lot of work for us to do, because by framing the future changes in healthcare through the lens of social accountability, we ensure that tomorrow's health professionals are not only competent, but also socially responsible and responsible to the needs of their communities. And in 2024 Jan, Harvey Feinberg gave his inaugural Lincoln Shen lecture at the same conference that I've been talking about at the University of Miami. And he made 5 observations. He talked about equity in healthcare. He talked equity in access. So if we want to provide equity in access to health services, policy and practice must be directed to achieving this goal, as it will not be just the, we are only talking about numbers, increasing the numbers. But are we trying to see, are we being able to see what it is doing to the population? Are we looking at the rural and the urban divide? Are we looking at whether there is this equity in all frames of life? So equity will not be achieved by just increasing the number of health professionals. We need to think a lot more than that. The second observation by Feinberg is technology-driven competencies, and I've already talked about this. Specifically, CBME must continue to evolve and adopt new technology, new competencies related to technology. And technology will drive the recognition of new health conditions and alter health systems in ways that require the revised competencies. I have spoken about interprofessional education, and Feinberg also talks about it. And these will genuinely integrate the roles of different professionals, doctors, nurses, pharmacists, nutritionists in the care of patients and in the protection of the population health. In other words, only when interprofessional practice is a reality will the ideals of interprofessional education be possible to realize. This we must bear in mind. And all health workers count. I don't need to elaborate on this. We have to have highly trained specialists and also highly trained community health workers also. And education for life, which means continuing education, education that provides life satisfaction, and education that stresses the life cycle. Because we must remember that our education should tailor to every stage of a lifetime, from conception to cremation, from prenatal care to end of life care. However, there are challenges, as Feinberg says. What are we going to ask our students to call what they do? Is it a job? Is it something they are going to work 9 to 5, punch in, punch out, and having put in the hours, get that pay and be happy with it? So is it going to be a job? Is it going to be a profession? A profession of caregivers guided by ethical responsibilities along with their technical proficiency. So that is what most of us are trying to achieve, being, as far as our profession is concerned. But would you call, or what would you say that it is a calling? What I do is a calling. What is a calling? A calling demands accompaniment beyond empathy. We can strive to design health professions education to reinforce that, to reinforce and to see and to help that at least some of us can say, this is my calling. What is the next challenge that Feinberg talks about? Talks about uneven equality. And that is why deployment, development, and reliance on quality standards will go a long way. Then there is a lack of coordination between individual care and population health. The disciplines, technologies, and perspectives of medicine differ from those of the public health, and each profession will serve a vital role. It can make a tremendous difference, and the logistics and mechanisms for coordination need to be established for this, ahead of time. Then there is this separation of higher education, science, and delivery of health services. We see this all over the world. We see this in India. We have the UGC, we have the TBT, we have the CSIR, we have the Ministry of Health and Family Welfare, there is the ICMR. There are so many bodies. Of course, no doubt, there is now this attempt to bring all of us under one umbrella. But how will we sort of bring them all together and see to it that the solutions are highly localized in the institutional context, and see to it that everyone comes together and are talking the same talk and walking the same walk. This is very, very disturbing for me sometimes, when the left hand doesn't know what the right hand is doing. And this is what we need to help to inculcate. And of course, global cooperation. I mean, this pandemic taught us so much that if health professionals in different countries have previous experiences of working together, leaders will have an easier time and a more effective global response to a new global health threat, such as the pandemic. And that is what we need to remember, that these are the challenges that are before us. And so what do we need to have as a future-ready health professional? Hone the leadership skills and be a team leader. Soft skills will be more important than knowledge. And with all this technology and the digital era, we can reduce some of the burden on learning and memory. Don't make them mug up things. An underlining sense of responsibility towards our community and the patients we serve. Generalistic skills will need to be honed. Family medicine, general medicines, geriatrics, health prevention and prevention. Where is this family doctor or the gone? Why can't we again once more have family medicine come to the forefront and see to it? I'm sure many of us have benefited by our family physician, who knew not just me and my immediate family, but knew the whole entire family history. And that was so heartening, and just sitting and chatting with the family physician. Skills for lifelong learning. Try to deliver cost-effective care, and skills for quality improvement and innovation have to be honed. There has to be a continued trust and support from the community, no doubt. But the future-ready health professional will also need a high degree of adaptability, given the complexity and the change in systems, including being able to work with machines, data, and AI. Oh my God, there is so much that they need to learn and do. Remember that the future is bright and exciting, but it will not be easy. The challenges facing our healthcare system are great, and the key to overcoming these challenges lies in medical education and how we prepare our next generation of health professionals. Last but not the least, this is my take-home message to our dear students. Be adaptable, and also to the faculty, for both. Be adaptable and flexible, and not be disappointed when things do not work out. Inculcate the ability to accept failure. It is okay to fail. Pick yourself up and get on with the job. Thank you so much. for your patient hearing.
Thank you, Dr. Sucheta. I mean, it was really a wonderful, it was really worth it, the wait of extra 15 days for your lecture, but the way each and every slide is like a very long, hard work. So, with this, we present to you the.
Thank you. Thank you so much. Thank you.
The Rita Sood Memorial Oration, and we feel honored to present it to you.
Thank you.
And also, I was in two minds whether should we present the Lifetime Achievement Award or not. But since I think we can, after 10 years, we will give you another one. So,
Thank you.
because you are still hale and hearty and performing at superlative levels. So,
Thank you so much.
so we present that. And
thank you. Thank you so much. Much obliged. Thank you.
With this, we end our session. Thank you.
Thank you. Thank you, everyone. I'm just looking at what is written in the chat, and yes, you made my day, everyone. Thank you.
The recording will be available on YouTube also. So
thank you. Thank you.